Welcome to Doctors on Call.
Well, thank you very much.
Go ahead with your question.
My son, who's 28 years old now, was born with transposition of the great vessels. Now that he's an adult, is there a specific kind of cardiologist he needs to see?
Great question.
That's a good question. Adults, there are actually more adults today with congenital heart disease than children with congenital heart disease, and that speaks for the success of our specialties, that a lot of these children are growing into adulthood. And who is the best person or the doctor to see your son? It really depends on the area where you live in. In some centers, they are mostly being seen by pediatric cardiologists who sort of continue to take care of these patients as they grow older. And most of us in pediatric cardiology are very comfortable taking care of older patients with congenital heart disease, such as transposition of great vessels. In some other centers, there are other specialists who are called adult congenital heart disease specialists. They are adult cardiologists, but they specialize in congenital heart problems. Or they could be just regular adult cardiologists who have taken a particular interest in congenital heart disease and learned about it in their training. So it really depends on where you are. In our area, I would say, in my experience, most of these patients are cared for by pediatric cardiologists.
Or a combination of adults and pediatric cardiologists, because as they get older, we're comfortable with their congenital heart defect, but treating gout and talking about smoking isn't our specialty. So
right.
A lot of times we'll interact, and there are centers that specialize in both adult and pediatric cardiology disease. So our next caller is Marguerite from Kanawha County. Marguerite, welcome to Doctors on Call.
Thank you.
Go ahead with your question.
I was wondering if I have been diagnosed with COPD, and I was just wondering if this causes a stress on the heart.
Good question.
Okay, chronic
obstructive. What's COPD?
Yes, chronic obstructive pulmonary disease. It is a lung problem primarily, and it puts a burden or a stress on the right side of the heart, which is sort of the underappreciated side of the heart as far as the public goes. But it is the part of the heart that pumps blood to the lungs. And when there is COPD, it does put stress on that part of the heart. It can enlarge, it can thicken, and it can develop signs of heart failure with swelling of the lower extremities, enlargement of the liver and abdomen, those kinds of things, when it reaches its more advanced stages. But yes, it can put stress on the heart.
So the treatment then is to treat the COPD the best you can to relieve that?
It is. And there's some new therapies that are looking at treating the elevated pressure in the lungs. It's called pulmonary hypertension. There are some specific treatments that are being developed to treat that in the setting of COPD, as well as where there isn't COPD, where they have elevated pulmonary artery pressures for other reasons. But yes, to treat the lung disease first, and then, if need be, treat the effects of that lung disease on the right heart by using fluid medications to get rid of the extra fluid, etc.
Okay. Marguerite, best of luck to you. We have another caller from Kanawha County. It's Margie. Margie, welcome to Doctors on Call.
Hi. My question is, I have a heart murmur that I was diagnosed with as a child. I'm now 60 years old. And they said it would go away. I wasn't allowed to play recess or jump rope or anything. And I still have it. I'm wondering, is this causing me any problems now?
Have you ever had any imaging of your heart?
Any what?
Have you ever had an ultrasound of your heart or any pictures of your heart taken?
No.
No? So you've just had the diagnosis of a murmur, but you've never really been evaluated by a cardiologist?
No. Sometimes when they listen to my heart, and they ask me, I say, well, I had a heart murmur, but it went away. And they said, well, you still have one.
Okay. So a murmur that comes and goes throughout a lifetime.
I wouldn't say that it comes and goes, but the most common congenital disorder is a disorder at the aortic valve called the bicuspid aortic valve. Rather than 3 leaflets, you only have 2. And people can live their entire lives and have that, and have a murmur be present, and it really never bothers them. Some people develop aortic stenosis, which is a narrowing of the valve, or have leakage of the valve that causes it to be fixed. But it's possible that this is what this woman had.
Sure, sure. And Malek, there are bunch of different types of murmurs. So maybe she had an innocent murmur that's then developed. So we need to follow kids, even if you've had a murmur as a child and doctor tells you it's normal. routine follow-up is required to pick up new murmurs?
Well, I would say the routine follow-up by their regular physician. Once they've seen a cardiologist and they went through the motion of figuring out what kind of murmur they have, if we, at the end of the day, clear that this is a perfectly innocent murmur, I basically discharge them from my clinic and I don't ask them to come back unless they develop new problems. So it is unclear whether the caller, if she had a murmur that was innocent, went away, and like you said, developed something else. A murmur can be anything. So what I advise is to have this checked by a specialist, by a cardiologist, and do imaging of her heart, and then they could tell her still that it's an innocent murmur, or depending on what they find, they will make specific recommendations.
So she may have been okay as a kid, and now she's developed something else that
Right.
needs to be looked
Correct.
into. So our next caller is actually from Kentucky, Kathy from Martin County, Kentucky. Welcome to Doctors on Call, Kathy.
Thank you.
Go ahead with your question.
Okay, the question I have is, I've heard of this test called a cardiac CT calcium score, and I was wondering if you could tell me about this test and when it's needed, and is it more effective than a heart cath?
Excellent.
Okay.
Kathy brought us to where we wanted to go.
Exactly. It's basically an X-ray, if you will. It's done with a CT, and it's an X-ray test with there's no dye involved. There's no preparation. You can just come off the street and have this test done, where they actually will measure the amount of calcium in the arteries of your heart. It's not for everyone, though. It's specifically intended, according to guidelines, for people who have some concern about risk of heart disease based upon high cholesterol, family history, those sorts of things, where we would screen in someone where we're having some decisions that need to be made concerning how aggressive to be with lowering their cholesterol. And if we find calcium, then we know they have early disease, and we would treat them more aggressively. It is not as good as a catheterization. It does not tell us the degree of narrowing of a blood vessel. All it tells us is that there's calcium in the vessels, which is a diagnosis of hardening of the arteries.
And then they score?
It's a score you develop. The more calcium you have, the higher the score is. It's based upon the extent of the calcium in the arteries as well as the intensity of the calcification. So the more you have of intensity as well as the more extent you have of the number of arteries involved, you'll have a higher calcium score. And usually if you have a score between 0 and 400, we are going to talk about aggressive treatment with therapy to try to lower your cholesterol, stop smoking, maybe be on aspirin. If you have a score over 400, we're going to do some more testing to try to determine just how bad the
And then maybe you need the heart cath.
Later on you could, yes.
Okay, very good. Good luck, Kathy. Our next caller is Nancy from Wood County. Nancy, welcome to Doctors on Call. Go ahead with your question for our experts.
Yes, thank you. I'm 48 years old, and I have a pacemaker that was put in for SVT, supraventricular tachycardia, which is a rapid heartbeat. And